What's up, everyone? This is a typical chiropractic appointment here. We got Bree, who we're just going to do a full neck, mid-back, low back adjustment, stretch, to show you guys how it's done here. She's been in and out of the office. Today she's got some ankle pain, right, from running a little bit. So we're going to probably check the ankles out, look into her hips, her knees, her hamstrings, and just show you guys what a typical appointment looks like. So we always start off up in the neck and the shoulders, just feeling for any muscle tension. You can feel left side's pretty good, yay, and right side's a little tight over on this right side. So most people that come into the office, we're going to do full spine treatment, full body treatment, because everything's connected. So we want to make sure everything's working in conjunction and together. Look up straight for me. Down straight, up and down, up and down, up and down. Up and down, up and down, up and down, up and down, up, down, hold, and down and hold. Good, up and down, up. And all we're doing now, a little myofascial release or a little muscle release technique to help loosen up some of the erector muscles and the upper trap muscle on the right side of her shoulder, where she's got probably a little computer tension, right?
Yeah.
Always mousing around on the computer these days. Up, down, up, and down, up, and down, up, and down. Good. And let's just go sit up nice and tall. Squeeze back here. And you can even feel how the left shoulder moves pretty good.
Oh, yeah.
The right side, feel how good this side is. And this side's just a little stickier.
Yeah.
So if we start to kind of palpate and feel in the front of the right shoulder, you'll feel this guy's good, right? And this guy's a little, feel how sore that is on the right side. So we'll have to do a little work in your pec right here, okay? But let's go flat on your back, face up into the ceiling.
What's that like from? Like holding him out? Or
Just a little imbalance, posture.
Because I'm right-handed.
Huh?
You think it's because I'm right-handed too?
Generally, I mean, it's just the combination of factors like muscles in the shoulder from the computer posture get overworked. You've been running a bunch?
Yeah.
Nice.
I run the half marathon next week.
Nice. And you can probably feel right ankles pretty decent, right? Now you got some clunky in here.
Yeah.
A little crunchy. And the left ankle is actually real stiff. It's like a little stiffer. Have you had more right or left ankle pain? Or has it been pretty similar?
Yeah. Like when I run, I can feel it right up here.
Yeah. Okay, relax feet for me. Now you can feel the right leg pretty decent, right? And feel the left side, how it's a little, right side's good-ish.
Yeah.
Left side's definitely a little tighter, like up in the IT band area and up in the hips, okay? So we'll do a little work to help loosen up right in here.
Oh, yeah.
In the IT band, and to help the knees loosen up, okay? So leg up here. Good. Back down, leg up here. Definitely tighter on the left side. See how different? All right, let's go face down on the table for it. So she's got a little asymmetry in between the right leg and the left leg. The left leg's a little tighter down the back side. There's a little bit more neuromuscular tightness or tension down the left side. She also has a little more jammed up left ankle than the right ankle. And just feel here, feel the calf, pretty decent. Feel this calf on the left side, how much more tension on the left. And that's what's going to cause like this lateral leg pain and ankle pain and all that fun stuff here, okay? So what we're going to work on first, let's get her spine and pelvis all cleared out, which we're going to do a little work right here. Bend this left leg up, come in and out nice and gently. What we're doing now is a little pin and stretch technique, a little muscle work just to help loosen up some of her lateral leg, lateral pelvic muscles. Her IT band, her glute med up here, common muscles that get a little tight and sore. Running is obviously a linear sport, front to back, front to back, front to back. And so a lot of times the lateral leg muscles like the IT band, even the groin muscles, they can get over or even underworked and strained. And then that starts to cause hip discomfort. A lot of people start complaining about knee pain if they're running excessively, which so many people get this like lateral IT band syndrome, and it actually starts way high up in the hip and ultimately in the core and your oblique muscles generally. You can kind of feel right in here.
Yeah, it's really tender.
Just feel how it's tender and sore, right? So all we're doing is helping to loosen these muscles up, promoting a little blood flow down into them. You'll see after we get that low back adjusted, how the leg feels, okay? Now, today we're going to use the little gun. It's going to get a little loud, but if we had shorts on, we'd do some myofascial work up here in the lateral leg. Today we're just going to use that little arthro stim gun. And there's going to be a little tenderness in here. And this is so common when running that the calves get maybe a little overworked. The hips get a little tight. That's why cross-training and different exercises other than just running, even while you're training for a marathon, are real important. Okay, bend this leg up here. Back down, bend this leg up here. And back down. Let's check here one more time. That's pretty good. We're going to do a little work on this right leg. Come in, out. And actually the right hip, can you feel right here, huh?
Mm-hmm.
Okay, so we're going to kind of do a little bit different spot over here in the right hip. And there's probably going to be a little tenderness out here also. In. And you can kind of feel right through this lateral hip, how we get a little tension in these pelvic muscles here, okay? All right, good stuff. All right, pull your heel to your bum for me, so heel to bum. Toes towards your knee, and take a deep breath in, and as you exhale, pull for me. And don't stop. Breathe in, and exhale, pull. And inhale, and exhale, pull. Okay, take a break. We're going to go a little lower. Gently pull your heel to your bum. Pull heel to bum for me. Toes towards your knee. Good. Deep breath in. Exhale and pull. Inhale 3 times. Exhale, pull. And one more time. Inhale, exhale, pull. Feel this nice little hammy workout we're getting right now?
Yeah.
Now this is the good leg, okay? So what we're going to see on the left leg, can you gently pull heel to bum for me? Good. Deep breath in. Exhale, pull. Deep breath in. Exhale, pull. What do you feel on this side?
It's really hard to...
It's a little more difficult,
Yeah.
right? So today, she's got a little bit of an inhibited or a not so hot functioning left hamstring. And generally we end up with a little bit of an overcompensation down in the calf here. Not always the case. Okay, bend up here. Toes towards knee. Pull heel to bum gently. Oh, see how much stronger already? Breathe in. Breathe out. Toes towards knee, right there. Breathe in. And exhale. One more time. Breath in. And exhale. Now, it's not perfect just yet. Let's relax here. And we're going to come right back up to here. Toes towards your knee. Pull heel to bum. heel to bum. And exhale. Deep inhale, deep exhale. Just kind of meet my pressure right there. And one more deep inhale and deep exhale. Now we're going to come out here a little laterally, toes towards knee. Pull heel to bum for me. Good, that side's good. Come over here, toes towards knee, pull heel to bum. That side's good. See how strong? Heel to bum here. That's just the little one that needs a little work. You see how there's a little shake in there?
Yeah.
Now you guys can't feel that. You might be able to see how her knee just gives out a little bit. But a lot of the times we'll start to kind of pick a certain side to favor, that dominant side. And sometimes we even pick the non-dominant side. But when you're running, your hips are moving in opposition. So left leg, right leg, left leg, right leg. It's really common for like the calf on one side to get tight and the hip flexor on the other side to get tight, which is why this leg goes pretty close, heel to bum, and this leg is a lot shorter. You can see the space from here to here versus here to here is a lot less, right? So she's got a little torsion in her pelvis. We're going to do a little low back adjustment after we get her upper back loosened up and get her all loosened up here. Go ahead and take a deep breath in for me. Exhale out, whole way out. Breath in, breath out. Good, breath in and out. And in and out. Perfect. And we're going to go one more right here. Deep inhale. Exhale out, whole way out. All right. Okay, face me over here, left side up for me. Now we're going to do a little low back adjustment or a little lumbar adjustment. We're going to try to get a little movement in her SI joint, down into her sacrum also. Head here and here. Bottom leg straight, right there. And we're going to start to work on, or today just loosen up. You can kind of feel right here. Deep inhale and to exhale out. Good, good. Other side for me. That was good.
Yeah, that was good.
How much have you been running?
Pretty much like
Every day? You're doing the half marathon?
Mm-hmm.
Awesome. And here we're going to work right there too. You can kind of feel deep breath in and out. Good. Flatten your back for me. Okay. So Bree's been in here for a little bit. We see her every, I don't know, month, 2 months or so, just for maintenance care. And generally does real good. She loosens up pretty easily. And what we're doing, just a little foot mobilization to help loosen up her feet. There's 26 little bones in the feet. When muscles get tight and imbalanced, they start to restrict joint motion, which ultimately makes you really stiff. What we're helping her to do is just improve her joint movement. Relax your feet for me. Okay, now that is better. There's more internal rotation, but not great. So we have to give her some exercises to do to work on her internal rotation of her left hip. And a little baby bit here. Good. So that knee's good. We got one more little bit here. All right. Cool. I'm going to come over here to the front of the table. And then we're going to go nice and easy. You were having some headaches and some stuff for a while. Have those been pretty good?
Yeah, pretty good.
Awesome. You can kind of feel left side's good, but this right side, so she works on a computer all day long, so she's always using her right hand, and you can kind of feel right up here in your
It's really tender.
little tender on the right side of her neck. So we're going to do left first, nice and easy. One more here on the left now, shoulders down. Good. And one more here on the right. There we go. There we go.
Oh, that's so good.
All right. So we just did a little distraction in her neck. Bree doing a whole bunch better than a couple, 4, 5, 6
Yeah,
months ago
for sure.
when you first started coming in. We only see her like once every 2 months now, 6 weeks, 8 weeks. Push down to my shoulder. Stop. Push. Stop. Push. And stop. Push. And stop. Good. Relax down. Bend up here.
My hips are pretty tight.
Yep. Push. Stop. Push. Better than when we started.
Yeah.
Stop. Push. This is where core breathing comes into play. And especially push. One more. And stop. Good. All right, so that's typical treatment for a runner. We're going to go through some exercises off camera with her to have her start to work on strengthening her glutes and her hamstrings to create a little more symmetry in between the left and the right side of the body. It's very common that runners will start to kind of press off of one foot a little bit too much. In her case, she's overusing her left calf a little bit, and that's causing a little bit of tension down in the knee and a little bit of imbalance up in her pelvis. So we're going to teach her some exercises that are going to help to create some symmetry between the right hamstring, the left hamstring, the right glute, the left glute. We're also going to touch on some breathing exercises for her to make sure that as she's running, she's keeping her obliques and her core slightly engaged, which is going to help to prevent IT band and those lateral leg muscles that are real tight in her case today from tightening up too much. So hope you guys enjoyed the video. We'll see you for future patient appointments.